What causes constipation and how to never be constipated? Being constipated means your bowel movements are difficult or occur less often than normal. Nearly everybody experiences constipation at some point, but there are ways to prevent it. Doctors and healthcare officials don't consider constipation a serious condition, but still recommend specific tips to avoid it. Welcome back, folks, to another edition of Sweetie Kiwi. I hope you are doing marvelous. I'm doing fantastic. And if you are doing as marvelous as I am, go grab a cup of coffee, tea, or vodka. Let's roll. Today's conversation is very important because constipation is a condition that affects millions of Americans and also hundreds of millions of folks around the world. So, now, what are the causes of constipation? The thing here is that your colon's main job here is to absorb water from residual food as that water passes through your digestive system, right? After that process, it creates stool. That's the waste, right? Now, the thing here is that the colon's muscle eventually will propel that waste out through the rectum. Now, if waste remains in your colon too long, it becomes hard and difficult to pass. The thing here is that at that moment you have things like bloated stomach, or you can't walk, you feel heavy. Now, poor diet generally causes constipation. Even though there are other causes, diet is a primary cause for constipation, right? So if you want to keep your stool soft, if you want to keep your waist soft, you need to have that dietary fiber and plenty of water in your diet. Now, when I'm talking about dietary fiber, you want to get those from plants because fiber-rich foods are generally made from plants, right? Now, fiber comes in insoluble forms. So, soluble fiber can actually dissolve in water and create a soft gel-like material as it passes through the digestive system. So that's one. And then you have number two, you have insoluble fiber. Now, that type of fiber will retain most of its structure as it goes through the digestive system. Now, what you have to understand is that both forms of fiber, the soluble and insoluble, they will join with stool. And that's how the stool gets a greater weight. All right? The thing here is that the stool, to be able to go through your system, it's important, and ultimately go into the rectum, it's important that you have a right balance between the soluble and insoluble fiber. You also have, when it comes to constipation, another cause is stress. If you have stress, you have changes in routine, or any medical condition that will reduce muscle contractions of the colon or delay your urge to go to the bathroom, may also lead to constipation. All right? So basically, let me give you other types of other causes that may actually lead to constipation. If you're taking certain medications, right? I'm talking about high calcium antacids and pain medications. If you're pregnant, right? If you are dehydrated, if you don't exercise often, right? If you travel, for instance, some folks, when they travel, they might be constipated, and the constipation might be due not only to the local food, the local diet, but also to the change of routine. Now, there are sometimes underlying medical problems that may affect your level of constipation. So there are some medical problems that can bring the constipation. For instance, some diseases such as diabetes, Parkinson's disease, stroke. If you have some hormonal problems, for example, if you have an underactive thyroid gland, if you overuse or misuse laxatives, right? Again, the laxatives are usually medications that folks use to loosen stools. So instead of having the solid feces, you're going to have some fluid, some liquid feces. And If you have problems with the colon or rectum, I'm talking medical problems with the colon or rectum, including something called IBS, right? That's irritable bowel syndrome. If you have diverticulosis or intestinal obstruction. So all those things can cause constipation in the short or long run. I'll be right back right after this. Don't go anywhere. Welcome back, folks, to another edition of Sweetie Kiwi. We're still talking here about constipation and how to never be constipated. Now, what are the signs of constipation? Now, each person's definition of normal bowel movements can be different, right? Some folks will usually go 3 times a day. Some folks will go once a day. Some folks will go once every other day. The thing here is that it depends on what makes you comfortable. Every human is different, right? Now, however, you may be constipated if you experience any of the following symptoms. Let's say you have a rectal blockage, right? So you can't really go to the bathroom, or the feces will not go out. If you feel full, even after having a bowel movement, right? So it's not similar to having a bloated stomach, but let's just say you just keep constantly feeling full. If you are finding it hard to pass, so if your stools are dry, if you have fewer than 3 bowel movements a week, that becomes a problem, right? If you go to the bathroom only twice a week, that's really a problem. If you have straining or pain during bowel movements, this could also be signs of constipation. Now, what are the individuals at risk for constipation here? Now, the thing here is that if you have a poor diet, you are at risk of constipation. I said that before, right? If you don't exercise, if you're just a couch potato, chances are you might have some constipation. Another thing is if you're age 65 or older, because the CDC, the Centers for Disease Prevention, has said that older adults tend to be less physically active, and they also have some underlying diseases, so their probability of having constipation is high. If you're confined to bed, you are at risk for constipation. If you are a woman or a child, or if you are pregnant, because during pregnancy, hormonal changes and pressure on your intestines, from your growing baby can lead to constipation. Now, how is constipation diagnosed? This is an interesting conversation here. Now, diagnosis of constipation is different. Many people choose to self-treat because you can do that also, right? You can use over-the-counter laxatives. You can increase exercise. You can change your diet. The thing here is that make sure when it comes to laxatives, consult your physician. Let me just give a quick disclaimer here. This whole conversation, today's show, we're not giving medical advice here. We're providing general information only, right? If you have a particular situation going on, always reach out to your healthcare professional, because he or she will better know what is good for you, and because everybody's different, right? So we're giving you the basics here, and you want to delve deeper before making a decision. So when it comes to laxatives, consult a physician, all right? Now, you want to talk to your primary care provider if you've had constipation for a few weeks, if you find blood in your stool, for instance, if you have some kind of pain in your abdomen, right? If you're losing weight and you can't explain the reasons why, if you experience pain during bowel movements, right? Or if you just have like sudden changes in your bowel movements, right? The thing here is that your healthcare specialist will review your medical history, will ask you some questions about your symptoms or any medications that you have, right? Now, remember, when it comes to constipation diagnosis, you might have your rectum examined. So we have rectal exams and some blood tests, right? To check things like electrolytes, thyroid function, blood counts, all right? Now, in some severe cases, there are some tests modern technology is really great when it comes to diagnosing constipation, because if you have some severe case of constipation, your doctor might ask for additional tests, And this test could be something like barium enema X-ray. This is used to examine the colon. So they will tell you to drink a special liquid the night before the test to clean out the bowel. You can also undergo colonoscopy, right? Of course, colonoscopy is a test to examine the colon, and in this test, your doctor will, they will actually use a tube that is outfitted with a camera and light source. That's the colonoscopy, right? You have another test called anorectal manometry. This helps evaluate anal sphincter muscle function. So your healthcare specialist will insert a thin tube with a balloon tip into your anus. Not very pleasant, but again, if we're trying to diagnose constipation, you got to go through some things and make sure that you do all your best to cure it. And the last test that your healthcare specialist might apply to you is something called a marker study. Now, this is also called a colorectal transit study. It's used to test how food is moving through your colon. So for this test, they will give you a pill to swallow, and that pill will contain tiny markers that will show up on an X-ray. All right? I will speak to you right after this. Don't go anywhere. Welcome back, folks, to another edition of Sweetie Kiwi. I hope you are doing fantastic as I am, and we are still having a conversation around constipation, and I want to talk to you now about treatment and prevention of constipation. But before I do that, I want to invite you to, I want to say a big thank you for all of our millions of viewers and listeners and fans throughout the world. The Sweetie Kiwi community cannot be anything without you. We really appreciate that. And I want to invite you to, if you haven't already done so, to subscribe to our channel, to turn on the notification bell so you can receive news gems every single day. We drop this kind of gems every single day. We really appreciate your help here. Comment below, give us your experience about constipation, share this content. Everybody needs to know what constipation is and how to prevent it, and like this content. All right, now let's talk about treatment and prevention of constipation. Now, to treat, when it comes to constipation, you can change your diet. Changing your diet and increasing your physical activity level are just the easiest way to treat and prevent constipation. Those are the natural ways. So, change your diet, eat better, healthier, and move a little more and more often. Right? Now, if those things don't work, try other techniques. For instance, try to drink more, right? Drink up to 2 liters of water a day. Again, I'm not talking about any other fluid, just water, right? You want to reduce your consumption of alcohol and caffeinated drinks, right? Because all those, caffeine and alcohol cause the dehydration, right? When it comes to diet, as I said earlier, you want to add fiber-rich food to your diet, so you can pass stool easy, right? Talking about beans, whole grains, vegetables, raw fruits, right? You also want to exercise more. Now, when it comes to exercising, everybody has their own regimen, so I'm not going to give you some kind of amounts of minutes. I mean, if you feel like you need to exercise 30 minutes, 60 minutes, 1 hour, 2 hours, 3 hours per week, do it, right? Try to move. That's the bottom line, right? You can walk, you can run, you can bike, you can swim, anything that makes the body move, your muscles contract and retract. That's very, very good. Now, the thing here is that if you feel like going to the bathroom, please don't delay, right? Because the longer you wait, the harder your feces can become. All right, that's very important. Now, I think I said it earlier that you don't have to use laxatives. If you have to, consult your doctor, and if he or she prescribes those to you, use them for a short period of time just to help soften your stools, right? That's very important. Another thing that you want to do is that you also want to think about your overall lifestyle, right? Your lifestyle is very important. Are you sleeping well enough? What time are you eating? Because not just the food you're eating, is when you're eating it. right? When you eating, are you eating late? Do you have a sort of a healthy lifestyle? Right, this is very important. Now, another thing you have to remember here is that when it comes to treating and preventing constipation, you also have to make sure that you stay away from drugs, right? From banned substances, because those have a negative metabolic effect on your body and colon, and you don't want that, right? You don't want your colon or rectal processes to be impacted by some kind of adverse substances. All right, so this is very important. So this is basically it, folks. I really appreciate you being around. Thank you for sticking around. I'll be right back right after this. Welcome back, folks, to another edition of Sweetie Kiwi. We want to give a big shout out to all our millions of viewers in Africa. We have our viewers in Nigeria, in Ghana, in South Africa, in Congo. We really thank you. Our viewers also in Europe, in Asia, in the United States, in Brazil, all over the world. Thank you so much for your support. Really appreciate that. So today's conversation was around constipation and how to never be constipated. I talked about the causes of constipation, signs of constipation, individuals at risk for constipation, diagnosis of constipation, and treatment and prevention of constipation. Right? So this is a recap of today's show. Before I go, I want to give you a quick call to action. You know, we like to tell our viewers and listeners to try new things. Just, it's not about just listening to the show and going back home. The idea is to change things in their life to live a better life. So today's call to action centers around a few tips. Now, change what you eat, change your activities. To prevent constipation, drink enough water, include fiber in your diet, reduce the intake of dairy products, right? You want to be more active. You want to try to have a regular poop schedule. This is very important. Once a day or twice a day or twice a day or once every other day, whatever it is that works for you, try to make it regular. Reduce or eliminate stress. Ditch laxatives as much as possible. And stay away from some medication, right? Especially medications and drugs, right? I talked about things like antidepressants, narcotics, and iron pills. All right? Thank you so much. Stay healthy, and most importantly, be marvelous.